Good morning, remote attendees. Doing a sound check. Brian Alston, can you hear me? Thank you very much. We may be starting the meeting a few minutes late. It looks like there are some impacted by traffic.
Morning, calling the Cook County Health and Hospital System Finance Committee to order. Will the Secretary please call the roll?
Director Harrington,
Present.
Director Lowry,
Present.
Director Robinson,
Present.
Chair Ryder,
Ryder is here.
and for the record, Chair Garza is also remote.
Since we have Director Lowry on participating virtually, at least for the moment, is there a motion to allow Director Lowry to remotely participate in the meeting as a voting member?
So moved.
Motion's been made. Is there a second? Second. Motion's been made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye. Aye. Opposed? The ayes have it. All right. The next regular meeting of the Finance Committee is scheduled for Thursday, June 4th at 10 a.m. Do we have public testimony?
We have 3 registered speakers. The first speaker is Ann Irving, followed by Dred McCurry and Lisa Egan. And just a reminder, you have 3 minutes. I'll remind you when you have 1 minute remaining, and then when your time has elapsed.
I would also note that we've been provided with information for the public testimony.
So I wanted to, my name's Ann Irving. I'm Regional Director with ASB Council 31. I wanted to briefly walk through that document that we provided that just demonstrates our concern that CCH is struggling to hire sufficiently to enable CCH to comply with an arbitrator's order that the guidehouse contract must end at the end of December. So the data, the first page just shows you the timelines the arbitrator's order established for adding new positions that will perform the work that Guidehouse is currently performing. The Guidehouse contract was eroding our bargaining unit, and that's why the arbitrator so ordered. And 160 positions are to be added by December 1. And then if you turn to the second page, we're 5 months into this process. The wind down, there's supposed to be, as the arbitrator set it forward, a wind down where staff are added as Guidehouse is moved aside so that by the end of December, revenue is not impacted, the work is being done, but now by CCH employees and not by a contractor. Unfortunately, for the positions identified in the arbitrator's order, there's been zero progress made since the order, which occurred in the fall, since the budgeted positions began to appear December 1st. In fact, for the titles identified in the order, CCH has lost ground. So we're actually just on net, we're 4 positions down from where we were at when the process began December 1. So we're flagging this as a major concern and wanted to provide some perspective on this and our sort of hope for how we might fix it. So I'm gonna, if you don't mind, I'm gonna have Lisa Egan speak next.
Good morning. My name is Lisa Egan. I'm president for Local 1111, along with my members. We're here today because Guidehouse, you probably remember Guidehouse is doing our ASME work. They have been performing our jobs, our livelihoods. Last Halloween, outside, the arbitrator said Guidehouse has to go. No longer than December 31st, 2026. We're not happy to see the Guidehouse contract extension is on your agenda today. Again, another contractor coming in, taking away our livelihoods, our jobs, our health insurance, and our pensions are being taken away from our members. We're not happy. But we're not surprised. This is county taking their sweet time, posting positions, not even posting positions, not doing hiring. Arbitration order to wind down, where CCH staff up, it needs less help from Guidehouse until they're gone. We perform the work. We perform it. Guidehouse ain't doing nothing better than what we do. They use the same programs we use. They don't have any advanced programs to help with the insurance verifications. We do that. They're on our programs. They're on our one-source programs. They're using our cerner, the taxpayer cerner. The taxpayers pay for, the county pays for these programs, but Guidehouse is using all our resources, and we're paying them to do it. The reason why we're here today is because CCH hasn't made any progress. Not one additional staff added to the titles, the arbitrator identified for the 160 union positions. Not one. Not one single person has been hired. We won that arbitration. So now they only have 8 months left to hire the staff they said they need to do the Guidehouse work. And so far, since last Halloween, 6 months, they made zero process. That's what we need to talk about. Why ain't the process being done for hiring? What is going on that they cannot hire somebody? What is taking so long?
1 minute remaining.
Oh, it's kind of funny how upper management gets hired in a complete second, but let a union member get hired and that never happens. Thank you for your time.
Good morning. My name is Dree McCurry, and I need to make sure I make that correct. It's Dree McCurry. My mother would be mad if I did not correct you all. So it is Dree McCurry.
I'm so sorry.
No, it's okay. I am the president of Ask Me Local 1276, and I'm here with some of my Ask Me members. And this committee has supported President Preckwinkle and the Cook County Board in their resolution that CCH should hire Cook County residents, not contract our work out. I know that you agree that people in our community need a living wage and a pension. Here you have an opportunity to make a difference for 160 people and to hold CCH accountable. We are asking you to review the contract extension today. If you break down the money, they're asking for, on a monthly basis, is full force Guidehouse. It's actually a little bit more per month than what was paid to Guidehouse last year. This is not a wind down, this is business as usual. CCH needs to comply with the arbitrator's order. And the only way that's going to happen is that you all hold them accountable. Here is what we're asking you to do. If you're going to approve this contract extension, they need to share a plan on how they intend to get the 160 people hired. What real goals and actions and support these goals and reporting whether they are taking those actions and meeting those goals. We appreciate your time, and we didn't come here to waste your time, but this has been a very frustrating process for myself and all of our members. So we ask you to, if you're going to do this, to hold people accountable, to live up to what you all, we say that we're supposed to live up to as CCH. Thank you for your time.
Thank you. Any other public speakers?
No other registered.
Any other members of the public wishing to offer public comment? Any other members of the public? Any other members of the public? Hearing none, we are going to move to the next agenda item, which is the April 20th Finance Committee meeting minutes. These were approved at the April board meeting. They're being presented for the committee's review and discussion if necessary. Are there any corrections needed to be made to the minutes? Any corrections? Any corrections? Hearing none, is there a motion to accept item 3A, the April 20th, 2026 Finance Committee meeting minutes?
So moved.
Motion's been made, is there a second?
Second.
Motion's been made and properly seconded, any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? The ayes have it. I'd like to note for the record that Commissioner Lowry has, joined us, in person. Next is our action items, contracts and procurement, total of 22. Welcoming, Charles Jones, our Chief Procurement Officer, up to the table to help, get us started. A quick note, request number 8 is being withdrawn. That's, the Stryker contract regarding, the Triton AI hemorrhage protocol technology. Charles?
Yes, thank you. Good morning, Charles
And we'll
Jones.
be talking about the guidehouse extension as part of this, too.
Yes. Good morning, Charles Jones, Chief Procurement Officer for CCH. With the withdrawal of request number 8, we have 21 items that for you today. 20 of those 21 require responsive letters from the Office of Contract Compliance. We have 14 back with 6 in progress. Thank you.
All right. Request number 1 through 4 are being presented by Marlee Hendricks, Cook County Department of Public Health, Director of Public Health Administration.
She's remote.
And she is remote. So Marlee, go ahead and take it away.
Great, thank you. And just to double check, Debbie, is this the first one?
The first one is up.
Great. The first contract that you have before you is a request to extend a contract with zero fiscal impact through fiscal 26 in support of our lead contractors for remediation. Any questions on this one? Okay, great. This next request is a extension, a request to extend an increase through fiscal 27 for Saldemore. This is a request to, this service is an effort to have grant-related contract specialists through procurement to exceed $156,000. All right. Lastly, we have a request to amend, extend, and increase in the amount of, or not to exceed $255,000 for Clarity Partners. This vendor supports our website maintenance. Any questions on this one?
Does anyone have any questions for this item or any of the other items?
I have a question.
Sure.
I'd like more information about the, they're talking about increasing, awareness of relevant resources. So it'd be nice to know what the outcome of this has been.
Sure. We can definitely get you more specifics.
Don't need to give it to us now, but you might be able to pull it together and give it to us at a subsequent meeting.
Sure. And so you're just looking for more information on how our website is getting information out there?
Thank you.
Perfect. Thank you.
Yeah,
Next.
one more.
Thank you. Next up are requests number 5, 5, and 6, health plan services being presented by Aaron Gleaner, Chief Administrative Officer, Health Plan Services. Oh, I thought we did 4.
Yeah. No, they have 4.
Oh, we had one more, so?
Yes.
Oh, I thought we had already done the last one.
Yeah, Marlee, we still have
Marlee, you
number
still
4.
have the last one.
My apologies. I wasn't sure if this one would be included. All right. So this last request. All right, my apologies. So this last request, that is the last request, is a request to extend a contract for Res Publica. So this is running through fiscal 2028, not to exceed the amount of $4,656,000. So this is to support our communications program.
Any questions on the Res Publica contract? All right. Now it's your turn. Thanks, Marlee. Now it's your turn, Aaron.
Thank you.
Apologize for that.
Good morning. I have 2 items before you. Both have a relationship to our fiscal resilience projects where we are doing contract extensions and also renegotiating fees under those contracts to reduce the administrative fees for cost savings. The first one of these is an extension of our pharmacy benefit manager services. Total amount is 1.4 billion. Most of that funding is the pass-through claims amounts that are paid directly to pharmacies for the pharmacy claims that they bill to us. A much smaller proportion of this is related to the administrative fees to the pharmacy benefit manager. Again, we've renegotiated those fees and expect between 3 and 4 million of cost savings related to the contract in fiscal year 2026. The next item is a similar extension of our third-party administrative services vendor, Evolent Health. This is exercising the remaining renewals in the contract and also includes a renegotiation of the administrative fees as a part of that. Total cost savings is expected to be between 12 and 13 million for this one.
Any questions for Aaron on either of those items? Hearing none, thanks, Aaron. Thank you. All right. Request number 7 being presented by our Chief Medical Officer, Dr. Lauren Smith.
Good morning.
Morning.
All right.
The first contract is an executed contract with Stryker Sales. This is for med-surg beds as well as pump services and accessories, as well as ICU beds, pump accessories, and big wheelchair stretchers with scales and accessories, and this also includes the service plan for those. So this is an execute contract with Stryker Sales, not to exceed the amount of $2.415,928.79. And again, this is a one-time capital purchase with extended service plan.
Any questions for Dr. Smith? Hearing none, thank you, Lauren. Next up are requests, oh, you still have more.
Oh, many.
Yeah, you're in the 2 categories here, 9 through 12.
Yes. So the next is an increased contract with Inari Medical. They provide catheters that we use in the cardiology space. This is not to exceed the amount of $145,000 through a period March 26, 2027. The next is an extend and increase contract with Lincoln Park Dialysis, DaVita. They provide dialysis services for our patients at Cermak Health. This is not to exceed the amount of $1,108,400, extending through a 24-month period ending August 31st, 2028. Next is an extend and increase contract with Biomed. They provide devices, again, used within our cardiology services. This is in the amount of not to exceed $617,000, extending through a period, 12-month period, ending March 14th, 2027. And lastly is an execute contract with Philips Healthcare. This is a one-time purchase for laser equipment that, again, will be used in our cardiology space for electrophysiology and cath lab, not to exceed the amount of $230,000. And this is a one-time capital purchase.
All right. Any questions for Dr. Smith on?
Yeah, I have a question about number 10. This is Lincoln Park Dialysis Services. Do they report to us their patient satisfaction with the services they get? Was that part of the contract, or do we know?
I do not know the answer to that.
Okay. Nice to know.
Any other questions? Hearing none.
Yeah. So I don't think they typically patient satisfaction surveys do not go to the ND. And this is at Cermak, so we would have their survey.
All right, thanks, Lauren. Scott, you're sprinting to that chair. Twice. Request number 13 and 14, finance, being presented by Scott Spencer, our interim chief financial officer. Wynn, why don't you grab that chair right there on the end, and Eric's already got a chair, so, we have request number 13 and 14, I believe the first one's the hot topic for today.
Yes, good morning, directors. Scott Spencer, interim chief financial officer. So this request for Guidehouse is an extend and increase contract with a fiscal impact not to exceed $13,050,000, and will take the contract period through December 31st of 2026. This provides the staff augmentation and managerial services, managerial support rather within the revenue cycle area, and allows us to continue that staff augmentation as we continue to recruit for the open positions.
How many positions are we talking about? How many open positions do we have?
There are 160.
160 that we're gonna fill. There are 135 currently posted.
And how soon do you think you'll be able to do that?
We are working diligently to post these positions right now. There's a challenge to finding people within the area that can do this work, but we are posting actually ahead of what the agreement asked us to do. So we knew that it was gonna be challenging, so we went ahead and posted as many positions as possible now.
Okay, so, do you have a copy of what was handed out to us?
I do not.
Okay. Now, we're not in an open debate, so so there might be things that need to be reconciled between people's numbers offline, but now we're sort of in it, at least at this level. There's some dates on here, starting with, number of positions, going through different calendar dates. Can you explain to us, because we're not reviewing the settlement agreement or all that, what the benchmarks are to fill these positions that are laid out through the settlement agreement? And I know we have other people from DHR and other places that might be able to, fill in blanks too. So however you can roll us through this.
Yeah, I think this is accurate on the first page of what we were required to post between now and the end of the fiscal year, and then going into the next fiscal year.
So this reflects the positions as they need to be posted coming up to this point. Okay.
Correct. So what we did is we took the 135 that from 12/1, 6/1, and 9/1, we've already posted all of those because we knew there were going to be some challenges hiring in these positions. Okay. So as of today, and I mean, RJ might be able to back me up on this, we have over 20 positions where we have accepted offers and they're pending start dates. So we have made some progress. Again, slow going, it's not as fast as we'd like, but we do have targeted recruitment going on for these positions.
Can you tell us what that targeted recruitment looks like? Because I think that would be.
Yeah, so we're using LinkedIn sourcing. We're looking at high volume applications. We're also looking at, in some cases, do we use accelerated hiring for these positions? And we'll be looking at job fairs over the next few months, right? So we'll probably have to have several that will target these particular positions. There are some challenges with MQs that we're going to look at. So do we need to make adjustments to what those look like in the future? But we're going to have to think outside the box to be able to fill these positions. But I want to make it clear that there is not, I don't know how to say it in the negative, we are making progress and we are doing work to get these positions filled. There is no world where we don't want to fill them. We are working to fill these, and I think with what we're doing with the extension, that only goes to the end of the year, so that would keep us in compliance with the settlement agreement.
Okay. There's a question about, to the extent that where the contract, it looks like 80% of coverage over positions, so there's a question of whether that signals whether what we're expecting to do by the end of the year versus tapering off. Are we tapering off the contract at the appropriate level? So I just want you to react to that. Like, what What are we budgeting for under this contract?
I don't think, I think we typically budget a little higher. It doesn't mean we're gonna spend the money. I think that is the goal. We just wanna make sure that should an emergency arise and we run into a major problem, we wanna be able to still continue to work. But there is no thought where we're not gonna fill these positions or we're intentionally not trying to do that, as I've alluded to.
Well, I think we have to make sure that people are feeling it. What's that?
So just, usually it's a one-year extension, and we actually adjusted this term date so that it would end on the end of the year, so we wouldn't
Understood.
yeah, okay.
Yeah.
Understood. You know, this is your job, right? And I'm not gonna say that I'm in the middle of doing this. I have experience with my job here is to help guide the committee when we're looking at, contract items, and that goes to duration and extent and amount and all that stuff. You know, we're monitoring, as you know, you guys have done a great job with the operational departments and doing the conversions and all that. This is a little different because we're not converting, people from, necessarily from Guidehouse into this, right? Because these are people who live other places, whatnot. But I'm wondering if are we thinking about things in terms of filling these positions? So when we get to the end of this contract, are we looking at, how we can move people through the process in terms of, it's like the third-party biller position? That's not an entry level position.
No.
So are there ways that we can use promotional opportunities to then free up other positions to bring people through? So backfilling into there with current CCH employees that then will allow us to recruit other people?
Those are options we're gonna have to look at. We're partnering with our operations team. And I do believe that we have a meeting with AFSCME on the 18th to discuss, hiring options. And I know they have some thoughts that they wanted to share with us as well.
Okay. Well, that's part of what I'm looking for too, I think, is in terms of trying to figure out how we get there, is whether we're, you know, things that we've done very well at recently is doing the accelerated hiring plans and, you know, working with the union on postings and promotions and things like that in order to do a quick churn. So I'd like to see, we've gone to the agency reporting, I think, every other month versus monthly. Because this is something that has a deadline, and we're gonna have another, you know, if we're not hitting the deadline, you guys are gonna be back here asking us to look at some other contract or, you know, we're gonna be in breach of the settlement agreement or whatever's gonna happen. I'd like to keep Guidehouse on a monthly reporting, so that way we can be abreast of what's happening, and, you know, you can report on, you and finance can report on our progress, how we're doing, in case there's more stuff we need to throw at it so we can get to the goal.
Absolutely.
What's that?
Absolutely.
Okay, we can do that. All right. Bill?
Thank you, Chair. And Wynn, thank you for that update. And I want to say also thank you to our public speakers today. I think in all situations, leadership is rooted in communication and collaboration. And in a situation such as this, those components have never been more important. So as we go forward, and I know you will, but I want to ensure that CCH is in touch with and communicating with AFSCME, because I think at the end of the day, there's a common goal and there's a common directive. So with that, thank you for what you're doing. Let's keep going.
Anybody else have? I got one or two other things, but I want to make sure I give opportunity for other folks to say.
Yeah, and looking at this, this is a snapshot in time, and it would be interesting to see where we've been historically, because we know where we are now. But in the future, it would be helpful to know if we've been better or worse. A historical perspective would be good, to look at our ups and downs and where we are right now.
I think historically with this not necessarily with, it's hard to explain, let me make sure I get it right. It depends on how you look at the issue. The function that these folks, that has been outsourced, I think, has been outsourced for a long time, but also there was no PIDs attached to it. So if you look at it like, oh, we didn't have a problem until recently, but that's because the structure of it was not resolved, and some would argue that we've been upside down on these positions for a very long time. I think so. I think what we have to have is make sure that we have the asterisk next to this, because this is there's history that came careening down the highway. I think both. A lot of things can be true. One, I know that our public speakers, because they've been here before, and this has obviously been an ongoing thing, they're frustrated. There are employees, they're trying to work through a problem. I know that you guys have worked your asses off on a lot of different conversions and transitions. The things in the revenue stuff in finance has become a huge problem over the course of the year, and sort of came in while we were working on other stuff. So I believe that you guys are working on the problem, but I could also understand that the communication also isn't there, and people have different levels of trust of what's happening. So I could be empathetic to all those different things, but at the end of the day, I think for all of us, and this includes you and your team, everybody's going to be happier when we get this plane landed and we have these positions fully brought in-house. And I don't know, it's going to be I know that it's going to be a challenge for a lot of different reasons. I think if there's creative things that need to be thrown at the wall to get them filled, we just got to keep all those options open. And again, this is your area, Win, and I have faith that you're going to think creatively on this. But we also have people here who've worked in operations and on the board and workforce development like I have. And so if there's things that we can do to help lean in so we can get these things landed, so when we get to the end of the contract, all the, next time we're talking about Guidehouse, we're talking about things that don't impact our union workers, and we're in compliance with the settlement agreement. So, Eric, I don't know. Would love to hear about progress conversations at the next finance committee meeting, which is in early June 4th. My last day before I go to a meeting in Minneapolis.
Yeah, we'll update you then on our meeting with AFSCME and then any progress we've made.
Yeah, that would be great. We have a board meeting before then, so if there's any sidebar reports that you can give me, so I can, so actually I can't have one-on-ones with anybody on the committee until we get another person appointed.
We can share relevant information in an appropriate manner when
Yeah.
the board briefing.
Yeah, you from staff, right? Okay, I just can't do it.
And nor should you, right?
Right, right. But I'm excited to getting people to where they're happy. So as we consider this contract, having those reports is going to be important. All right, Scott, did you have anything?
Nothing more to add.
Okay. All right. Thank you, Wayne. All right. You have another item.
I do. So this is a new contract with Strata Decision Technology It's a new contract. They're not a new vendor, to CCH. We currently have a contract, with this vendor. We, use their, Axiom, application. It's the software that we use for financial reporting and budgeting. And so this is a new contract, for, 5 years, excuse me. Takes the contract, through November 30th of 2031, for a fiscal impact of $1,513,594. Our current contract, expires at the end of this month, so that the first line, 138,000, will bring us to the end of the calendar year, and then we'll be on a regular, 12-month, cycle, within this contract. Yep, and that's it.
Any questions for Scott on this last item or on the previous one we discussed?
One thing I will say is, I think the guidance you gave to, Wynn is extremely good, and to try to make both sides, accomplish the objective. And I would look forward to supporting your comments. I think they were very good.
Thank you. Thank you, Scott.
Thank you.
We're now going to move to request number 15 through 18, Operations Development. Our soon-to-be on his way, Craig Williams, our Executive Chief Operating Officer.
Good morning. First one I have is Imperial Parking. It's an extended increased contract for $3,131,000. It's a 12-month, we're asking for a 12-month extension, through 3/31 of 27. And Imperial, provides our parking management services at Stroger, Providence, Core. That includes cashiering, janitorial, security services across all of these lots. We're finishing up an RFP, and so hopefully we'll award this to a new vendor moving forward, just so we have coverage as that contract is ending. Next one is Parkway Elevators. It's an extended increased contract for $2 million, 12-month contract extension, through 4/30/27. And they provide maintenance and repair services on all of elevators throughout the system. Also, just doing a RFP on this service.
Was this what we talked about before, that we had, so we have different systems across, and this we're now.
Before we were with Parkway, we had been on a countywide elevator contract, and we really weren't getting, they didn't understand the healthcare occupancy. And since we've been with Parkway, we've gotten much better service from them, and I would say better uptime. We're also in the process of doing a elevator modernization throughout the system. So right now, they just finished the Providence elevator modernization. They're working on the parking garage at Providence next, and then Stroger elevator modernization. So it's all around system controls and everything, and how the elevators respond to emergency and things like that.
How many, I know you answered this question before, how many different elevator systems do we have in terms of Otis versus?
I think the majority of our systems are Otis elevators. Here in the professional building, it's Kone. So I think those are the two primary systems that we have. There's a couple of hydraulic lifts too that, don't really fit in it. They're elevators, but not the same kind of mechanism.
Right. Okay.
Everything is working.
I would venture to guess not everything is working today. We tend to have, one or two out for various reasons throughout, but what I would say is the uptime has been very good. We actually get a daily uptime report that I have to say I haven't looked at yet today, but so we have a good monitoring of that, and yeah.
The one, none of you guys were here when this was put up. I think when we designed this building, we probably could have used at least 2 to 4 more elevators in that elevator bank. just because of the way it's a segregated, you know, it looks like you have, 8 elevators, when really you have 4 for 2 different sides of the operation, and when an elevator goes down, it disrupts either members of the public or it disrupts medical staff.
Yeah, and, you know, the elevators in this building, for a newer building, I think we've had more than our share of problems with these elevators. And there's also a little bit of user error too, right? Like, people get on, don't realize you have to swipe in, so they're kind of stuck there and they end up.
Oh, yeah.
So it's a constant,
Well, it
one thing
appears that
I'll
there's
really
two-
miss.
There's 2, on the staff side, there's 2 different, it appears to have 2 different swipe systems on it, so people are swiping the wrong thing.
Okay, I hadn't noticed that. All right. Next contract?
It may not actually be 2 swipe systems, just looks like there is.
Yeah. Cross-country staffing is an extended increased contract for $600,000, 12-month contract period, 7/1/26 through 6/30/27. We kind of strategically use this vendor to provide PT, OT, and speech, as well as audiology, temporary labor. So when we have vacancies there, they fill in. I'd say we we do a pretty good job of bringing people in for these positions. So it's not highly utilized, but this is an ability to provide patient care. And then my last contract is Natus Medical. It's an amended increased contract for $104,720 through the end of the contract, which is 8/31/29, and they provide services for our EG and EMG departments across the Department of Neurology, as well as provide mobile EEG carts to 24/7 epilepsy monitoring across the system.
Any questions for Craig? Thank you. Craig, when do you depart?
My last day is next Friday.
So, is that the board meeting?
Yeah, this will be my last,
Oh,
public appearance.
wow.
Although I will certainly be dialing into all the future finance. I hear about the progress on the guidance contract
I have to be honest, the progress you made on the operations side, you were about to get assigned to help us with the guidehouse, project, because
Thank you.
I will, again, I know I said this in the past, our other outsourcing issues that happen on the operations side, we've done a really good job, on that. A lot of that's the work that you and your team put into it, so.
Is this your last meeting?
This is my last.
Oh, then we should call you around the clock.
Here.
Thank you.
And, what is it, the new hospital's in New Hampshire?
It is.
All right.
So if anyone finds their way up to the Great White North, feel free to look me up. I'll give you a tour of the facilities and.
I just want to make sure the place is up to snuff when I have a medical
If
emergency
you're
up there.
skiing, you know, in Waterville Valley or Gunstock, and you break a leg, I'll be right there. I'll be on the slopes coming to deliver you.
I'm thinking I'm more at risk for a cardiac event.
No comment.
Craig, I'll be up there after the Bears win the Super Bowl.
Yeah. All right, we're gonna now move to, request number 19 through 22. Schroeder Hospital being presented by Donica Austin Kathy, our, Chief Hospital Executive, at Schroeder.
Thank you, Chair Ryder. Good morning, everyone.
Morning.
The first one is an increased contract with Jubilant. This is for radiopharmaceutical supplies for oncologic imaging in the amount not to exceed $1,256,000. The current contract period 11/1 of 2021 through 10/31 of 2026. The vendor will provide radiopharmaceutical supplies for oncologic imaging and evaluation for neuroendocrine malignancy, prostate cancer, and Parkinson's disease. And next, we have an extend and increased contract with BioMirieu. This is for reagents and kits for the BioFire multiplex PCR instrument in the amount not to exceed $392,483.13. Revised contract period 2/1 of 2026 through 1/31 of 2027. This is a sole source. The vendor will provide reagent kits, software upgrade warranty for our PCR instrument in the lab. This is a sole source as the vendor is the manufacturer of the already installed equipment in the laboratory and the source for the consumable supplies. And next, we have an extend and increase contract with Abbott Laboratories. This is for a rental reagent agreement for the PCR instrument systems, again, in the laboratory, in the amount not to exceed $298,317.05. Revised contract period 5/1 of 2026 through 4/30 of 2031. The vendor will provide PCR instrument systems for testing of COVID-19, HIV, Hep C, Hep B, and the accompanying consumables and reagents. And the last one is an execute contract with National Business Furniture. This is for furniture, accessories, and installation. This is a one-time capital purchase and installation in the amount not to exceed $205,695.65. This request is for the provision of furniture, equipment, installation for the new Cook County mail order pharmacy that's going to be located in Countryside, Illinois.
Great. Any questions for Donica? Hearing none, thank you, Donica.
Thank you.
Charles, do you have anything else on
No,
this,
sir.
on these items?
No, we're good.
Okay. So what I'm going to be asking for now is a motion to approve item 4A, contract procurement items containing request number 1 through 22, with the exception of request number 8, which was withdrawn, subject to completion of review by contract compliance, with a monthly report on the progress with the Guidehouse contract as it pertains to the settlement agreement with AFSCME.
So moved.
Second.
Motion's been made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? The ayes have it. All right. Charles, do you want to give us the MBE WBE report?
Yes, sir. Okay, on the screen before you is a report out for the fourth and final quarter for FY '25, September, October, and November. When you look to your far left there, for the month of September, we brought before you 20 contracts. Of those 20, 4 had contract-specific goals for a total of $10.5 million. We had one prime award for $1.8 million for 17%, and 2 subcontractors for $2.8 million. So $4.6 million and 44% for the month of September was awarded. Of those 4, we did have one waiver for $680,000. Contract that we have for health plan services, that provided a web-based system to determine the eligibility and benefits program, ended up with the waiver. Moving to your right in the middle, October, 12 contracts. 3 of those had contract-specific goals, $2 million. We awarded 2 prime vendors for $1.7 million and 1 sub for $30,000. So a total of $1.7 million there for roughly 8%. There was no waivers for the month of October. Lastly, for November, 12 contracts, 4 had goals, no prime awards, and 2 were awarded to subcontractors for $957,000, roughly 11%. 2 waivers for $1.89 was a contract for revenue cycle for workmen's compensation and liability services for $500,000, ended up with a waiver. And then a contract for operational that was water treatment management and testing for Strojan Provident for $1.3 million, ended up with a waiver. So rounding out the full year, your column all the way to the far right, for Contracts over 150, we brought before you 220 contracts during the year. 84 of those and $670 million had specific goals attached to them. We awarded 18 prime vendors for $39.5 million and 51 subcontractors for $114 million, rounding up a total of 69 contracts, $154.3 million awarded, and roughly 23%. For the year, there was 15 total waivers and $26.5 million. So the question arose about how does these waivers for 2025 compare with 2024? In 2024, there was 21 waivers for $60.2 million and 7%. So this is a trend down and trending in the right direction. Any questions?
Any questions for Charles?
Yeah, just a couple. Charles, thank you, and thank you for sharing that waiver information. You know, that's vitally important to me, and it led to my first ordinance as a commissioner. So let's continue that good work. I always say if you're not at the table, you're on the menu. So our job is to keep folks off the menu, so thank you for that. Relative to an overall report, I'm mindful that before the Contract Compliance Committee next week on May 13th, we're going to hear from Rafi and Nicole. Will we be getting a more robust report following that to this board? And if so, when is that anticipated?
Yes, I believe they normally, after they meet with the Board of Commissioners first, they come out the very next month. So I would think that in June, they'll probably be on your schedule.
Great.
So we'll double check it sometime in June or July, but definitely right after the Board of Commissioners first.
Yeah, that was my understanding, so thanks for confirming it. Thank you.
Any other questions for Charles? Not. Thank you, Charles.
All right.
On that, no emergency purchases being reported. So now we're going to move to items under the Chief Financial Officer, being presented by Scott Spencer. We're going to start off with grant award related items.
Yep, good morning again, directors. So we'll start with the receive and file reports. We have 4 items this month, all with an executive sponsor of Mark Sprinka, and for a total of just under 1.6 million. So any questions on that? Or on any of those?
Oh, yeah, sorry. Is there a motion to receive and file the grant award related items?
So moved.
Motion's been made and seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
All right. Let's now go to the March financials. Sorry, Scott, I forgot I need to take a motion on that one. I thought we were about to start the financials, but here you go.
Yep, here we go. So through March, we are 46 million unfavorable to budget on an accrual basis, and that is comprised of 2.7 million favorable on the healthcare side, and 51.2 million unfavorable on the health plan side. The drivers remain largely the same as they have been. Net patient service revenue unfavorable by 2.9%. However, capitation revenue is favorable. And then on the expense side, we've got claims expense unfavorable, as well as overtime and supplies and pharmaceuticals. Next slide. So our combined income statement here, which again is the healthcare, the provider side, and the health plan, county care, just running through things here. Again, adjusted net patient service revenue unfavorable by 2.88%. Total revenues, however, favorable once we add in the capitation revenue. So total favorable there, 2.28. And then our operating expenses unfavorable by the 4.92%, which is largely driven by the medical claims expense, and then the salaries and benefits and overtime, as I mentioned. So on the next slide, breaking out, healthcare, the provider side, so, our two hospitals and the outpatient clinics from the health plan, county care on the right-hand side. So as you'll see, the net income of the provider side coming in at, just under 2.7 million, and then the health plan with a net loss of just under 55 million. The next slide, waterfall report, not much to highlight here other than just a reminder of the variances. The green bars are the favorable drivers and the red bars are the unfavorable drivers. On the next slide, so volumes, still a little soft at both facilities. In terms, in terms of inpatient discharges at Stroger, inpatient discharges at Providence showing slightly better than budget. ER visits short at both. However, surgeries are ahead of budget at both facilities and better than prior year at both facilities. On the ACHN side, which is our outpatient clinic, outpatient clinics, we've got primary care visits and specialty care visits that are short of budget. However, that gap continues to close as the year progresses and is better than where we were a year ago. Next slide, showing our volumes over the past 6 years and how they've been trending. Slide 8. Our payer mix, Medicaid coming in at 49.1%, so largely unchanged from where we've been this fiscal year. But just to highlight, Medicaid did increase by 0.6% and uncompensated did fall by 0.2%.
Where are we forecasting dish payments on our uncompensated care? I mean, what are we expecting with the big beautiful bill and all that stuff?
Well, dish for fiscal 26 is not impacted. So I get 223 million in the budget. And
that's money that we receive on dish for years prior, isn't that, or is it?
Yeah.
So
correct. So
we
what
have more uncompensated care this year.
Yeah.
What's the dish payment going to look like in 27?
Right. So we're still looking at the Medicaid side. The Medicare side, we are expecting about a $12 million reduction in dish. So and part of that is because of that lag and the fact that uncompensated care over the past couple of years has decreased. So that's now kind of starting to catch up a little bit. So, but still looking to see where dish is going to be at for fiscal 27.
How do you book that? You book it as on an accrual basis, like 20, whatever we get in 27 gets booked in 26?
Whatever dish comes in is booked as revenue for that year.
Okay. So we're good this year on dish.
Yes.
Next year, the gap we have now, we'll see problem with $12 million reimbursement under dish. So
on Medicare,
right.
It'll be interesting to see with Medicaid. This is the first time in 5 or 6 years we've been under 50% Medicaid, and now we're obviously creeping back up in uncompensated, right? So it'll be interesting to see there. From a policy perspective, the program itself is safe until October of 2027, because that was a whole thing, right? They just keep kicking the can down the road. So.
Yeah. It's still.
We're okay for now, but we'll probably
15 months away.
Yeah, it's probably spring, early summer. We'll start seeing the discussions at the federal and state levels about what happens with it. So.
Yeah, I would make some political comments, but I don't know that it depends on. I mean, it's really gonna. This Congress can do something. The next Congress can really do something. Yeah.
Or undo it, hopefully.
What's that?
I said, or undo it, hopefully.
Yeah, uncompensated care is actually charity care. I mean, that's another word for care we
Correct.
provide and we don't get
Yeah,
compensated for.
correct, yeah.
So, and we had observed, last year with reductions in Medicaid, we were gonna have more uncompensated care moving forward. So this is the trend, and the trend is downward. Do we know what the bottom level is? Because I don't think it's gonna go up anytime soon.
Right.
And so I'm assuming it's going to continue to go down. And if that's the case, what are the projections? And is there a point at which we're going to be in trouble?
Well, we budgeted, Medicaid at 44%. So that's, looking at where we sit right now, obviously favorable to that, but, that's what we budgeted. So just trying to anticipate where things are headed, and I think that's part of the challenge is having the data and being able to predict where we will land. So, and that's obviously going to be a question as we build out fiscal 27 as well with redetermination and work requirements and all of that. So that's what we're working on now, and trying to build out what that fiscal 27 revenue looks like, because we are in the at the beginning phase of our budget development for fiscal 27.
Well, keep us posted, because I assume that the trend is going to continue.
Yes, we'll
So
do.
we don't see a relative end in sight.
Agreed.
Question, if you go back one chart, I'm not sure if you look in your top left quadrant, if that is actually to scale, but I find it quite interesting if we look at what's taking place with the number of visits versus the admits. So we can see that we are increasing on the number of visits and we're decreasing on the admits, and I'm assuming those are unique visits and patients, they're not necessarily the same. You may not know the answer, and someone else may have to look at it, but I think this is worth looking at because it's indicative of what may be happening from the standpoint of revenue. And this is not a small moment, I think.
I'm assuming charity care is going up.
No, that's not necessarily this at all. That's not, this could be something totally different.
And you're referring to the trend of the admits and the outpatient clinic visits.
Absolutely.
Yeah, and the fact that, their trajectory is different, going opposite directions.
Right, which from an operations or a revenue standpoint, that could be extremely significant.
Depending on,
What they are.
yeah, but it depends on what they are, because having more clinic visits versus admits could mean a healthier population
Right.
or an improving population.
This could be that upstream intervention that we've been talking about around a population health initiative where we try to avoid inappropriate admissions and see them in the clinic, right? So we're potentially, it's one graph, but yeah.
Unless people are going to other hospitals,
That could
which
be
is,
too. Yeah.
which can also affect your admits too. I think we're gonna be, based on what's happening in the market though, of healthcare and the federal government's assistance with, managed care, is that we're gonna see in Medicaid and all that stuff, is we're gonna see potentially, seeing more admits here, because there's gonna be less places for people to go. Unless private equity just swallows up all the small not-for-profit hospitals that have traditionally been safety net in the city, so.
Right, I think the point that I'm trying to make here is because we don't know, it might be really worth understanding what those populations are, because if those admits go down, that's the biggest revenue generator for the hospital side. And so if that is indeed the case, that should be taken into consideration of how we're going to fill the gap, or we're going to actually find another way, which we've talked about quite a few ways, to actually provide the service to the people, because again, and I know I always seem like I'm the bad guy, but the lights have to stay on. So we can't overlook that moment right here.
Well, I think, generally speaking, if you're looking at this number, with the two trends, as long as they're appropriate admits and you're not getting leakage to other institutions, then this is a good thing to see. But if those admits are going, if it's because people are getting diverted to other institutions, or we're not properly assessing people for, which was another problem that, healthcare had, for a long period of time, is they didn't want to admit people, they wanted to churn them and, get rid of hospital beds. So, that was, for the longest time, that was the trend at Provident, is we were downscaling Provident as an actual hospital where we would take patients in. So, it is worth understanding those numbers, so we can see whether this is a good trend based on population health, or if this is something else. There's something else happening that we need to flag. I do think in terms of safety net hospitals, unless we have a complete failure of government, that we're going to be the last standing institution in the safety net space. So keep your fingers crossed on that, because that's not just that's not a competition driven thing. That is someone needs to be there to take care of people thing.
And not to steal the thunder from our ops folks, but I know that they're doing, a lot of work around addressing, no-show rates and, just making sure that schedules are, provider schedules are as full as they can be. So a lot of efforts there to make sure that, maximizing throughput to the extent that we can on the outpatient side.
I hope indeed that is the case, but the only point I'm trying to make is, because of where this is happening, this is from my perspective, this is a need to know, because it has tremendous impact.
Yeah.
So understanding the numbers really matters here.
I will say, back when we were teetering a lot more, we used to spend a lot of time. This had its own slide. We used to spend a lot of time on it back in the old days. I think that not that we have to go back to the old days in terms of what we're looking at, but I do think this would be a good topic to visit on. Sam pulled out an interesting nugget, so maybe level setting on that information would be good for us to talk about next month, just so we could have an understanding of what's backing up this data.
Okay, make a note of it. Yeah.
Thanks.
Sure thing. So I think we're back on slide 9. Yeah. So just a couple things to highlight here. Well, first, wanted to mention that, and I think as I've mentioned to you all during the briefings, I did pull the denial slide from the deck, and the point there was, as we've made leadership change within the revenue cycle, I just needed some time to get grounded and kind of work through how we wanted to present that going forward. So just know that slide has been removed, and then the revenue cycle KPI graphic has changed a bit. And again, just a couple things to point out here, that the cash collections did drop in the month of March, as we had some recoups from the state of Illinois that needed to be posted. And then consequently, the AR days ticked up a bit, as you can see in the second graphic from the left. On slide 10, our charitable benefits and community programs, projecting just under $708 million at this point. It's about $2 million lower than we were at last month, so we're largely unchanged. The main drivers there being, of course, the charity care and the other uncompensated care, which is bad debt. On slide 11, our savings initiatives, again, just to highlight, temporarily suspending the rev cycle activities, again, just to give us some time to kind of level set and figure out how we want to present that to you. We have the county care savings that have increased now to 22.8 million, and that'll continue throughout this fiscal year and next as the health plan continues to work to right size. And then the vendor contract negotiations, which in other words is the budgeted agency savings of 40 million. We're locked in at this point about 10 million of that, but we're on target for the $40 million savings, assuming that the run rate continues to be what it has been, which is about 95 million on an annual basis. And then one addition to the bottom of this slide I wanted to point out is how we're looking at some of the budget shortfalls within throughout the health system in different departments, and how we are leveling that out. We have worked with the executive team, and they've worked with their teams to identify savings throughout the organization. So that's about 28 million in addition to our excuse me, our 3% holdback, and then we've got a small variance or surplus rather for on the payroll and overtime lines of about 10 million. So the combination of all of those elements helping us to balance out the budget shortfalls that we've identified through this point in the year. On slide 12 rather, excuse me, is a county care slide with showing the operating loss of 52 million. And again, just a reminder, the health plan continues to right size and work through the issues that are causing that, including the medical loss ratio and a variety of savings initiatives, and that'll continue this fiscal year and next. So with that, answer any other questions you have.
Are there any questions for Scott? Scott, one of the things that and this is what I was just talking to Eric about a moment ago, was, as our little aside, was I'm looking forward to seeing the rev cycle work fire back up, because I think we are getting a sense over the course of the last 6 months or so, it was starting to look it was starting to be opaque. So I appreciate the fact that you guys are, looking at it and making sure that it's top to bottom, reflective of where things are at, and that the information is being communicated to us in a way that not only is digestible and things like that, but is actually accurate and is telling us the right economic story for what we're doing. And we have our new Chief Revenue Officer here, Ben. I'm going to guess it's pronounced Mofker. I got a little note here. He didn't do it phonetically though. I had to figure it out. So yeah. That seat next to Scott gets warm, so we'll see it at some point.
Just a quick comment on that. I mean, yeah, our goal is to communicate to this group, what it is and what's happening, and to work through things and fix things as we can. So as far as it being opaque, I mean, the goal is to be transparent and clear and communicate to you where we think the opportunities are, and getting after them as best we can. So.
Yeah, and this comes with the territory of being, interim anything, because it doesn't matter, you know, how great your predecessor was, there's always some part of the operation that needs an overhaul or more eyeballs on it. So, you know, enjoy your time in the barrel. So, all right. So no other questions, for Scott. All right. Well, with that, we've exhausted the agenda, so we're adjourned.